any glaucoma patients. Before and after a PI or an SLT, we check the pressure. Typically 10 to 15 minutes after the procedure, we check it. Most of the doctors, if it's more or less than 6 points, like if it drops significantly below 6 points, or if it raises above 6 points, let them know. You know, sometimes they'll give them something else to lower the pressure before they leave. A lot of times the procedure itself will raise the pressure, so you know, you don't have to get too concerned. As far as we're concerned, the average pressure for an individual should run between 11 and 21. If somebody asks you, that's usually what it is. A lot of patients come in, they're doing this to prevent glaucoma, so the pressure may be fine, and then they're like, well, why am I having this done? They still need it done. It's to prevent the glaucoma from advancing to a full-blown thing. So there's probes that we put inside. These are individual use, but you don't have to change them in between the eye. If you're doing both eyes on one patient, you can use the same probe. Okay, so to begin, you just turn the machine on. And hit the measure button. Okay, and it's going to tell you load the probe. We all know how to do this. Probe. And then, it's not even going to let me do it because it's telling me to load. Yeah.
Do you want to measure?
Huh?
Do you want to measure?
Well, here, Sammy can measure you while I'm talking. How about that? There you go. So the way the machine works is it takes 6 readings right in a row, and then it averages them. It actually gets rid of the highest and the lowest and averages the 4. So that's what they're considering your reading. Have the patient sit straight up and down and look straight ahead. You want to be 4 to 8 millimeters away from the patient's eyes.
Very good.
And
That was
you can
perfect.
see it colored in every line. So that means it did the 6 readings. So that means you're good. If it just gives you 1 reading, a lot of times some doctors will use just the 1 and not average them. But as far as we're concerned, we want the 6 and then the average. There's a lot of error messages you get with this. A lot. It'll tell you if you're too far, too close. One thing to be aware of if you're going to do a reading is it has to be green. If it's not green, it's not going to give you a reading. It's going to give you an error message. That just means it's level and it's ready to go. What else can I say? Too high, too low. A lot of times with this model, you get static, and it's going to keep giving you an error message to repeat it. Take out the little piece here and rub it between your fingers, and that gets rid of the static. This piece also gets cleaned every 6 months. It gets soaked in alcohol. Actually, SPD will do it. They'll soak it in 70 to 100% alcohol and then rinse it, but it has to be dried really well, so they use the air dryer. And then just replace it and put it back in. It gets cleaned with alcohol. The any part that touches the probe here or this. Also, a lot of times, because we use the gel, you get the gel is still on the patient's eye even though you flush it. So it'll cause this little probe to stick to their eye, and then it sucks the gel back in. So then a lot of times you got to take the probe out and clean it. It'll just keep giving you an error message. So any questions? Lisa, do you have any questions?
No, ma'am. Can you check the pressure on my other eye, please?
Or you get rid of your probe. Sorry. No, we can.
For the SLTs and the PIs, is there an order for pre and post
Yeah.
on there?
It's
Okay.
on our flow sheet, and then there's also it's on the order sheet.
Okay. All right. Good. Okay. All right. Any questions? Okay. All right. Thank you, Deirdre. Thank you, Sammy. Thank you, Lisa.